painful intercourse and difficulty with orgasm can be fixed most of the time. It's not a cover your face and bear it. It's not that sort of thing. And with the right care and the right people, your sex life can be so much better.
Welcome to the Get Your Marriage On podcast. I'm your host, Dan Purcell, a sex and intimacy coach for married couples. My mission is to help you build and maintain a sexually vibrant and emotionally intimate marriage. Join me each week as we explore principles and practical tools based on Christian values to create the passionate, joyful, and thriving marriage you're designed to have. Hey friends, if you want better, more reliable, and satisfying orgasms, then this episode is for you. My guest today is Kristin Damery. She is a pelvic floor physical therapist. She's been doing this for 15 years, and her specialty is helping women find more pleasure and joy in sex through better physical health, specifically with the pelvic floor, which, by the way, if you don't know that term, that's the area between your pubic bone and your tailbone. It's the bottom, it's the physical foundation for our sexual health. She is an expert on this topic. In fact, you'll learn about things like what to do if you've had babies and how you can restore proper tone and strength to your muscles, what to do if you have pain in intercourse, what to do if you find orgasm is a little less reliable or a little bit out of reach sometimes. We're going to talk about things like increasing blood flow to your pelvic region, vibrators, her own brand of lubricant that she just launched called Lava Lube. My wife and I love this stuff. It's excellent. You'll hear about that too. And you'll want to stay to the end because she'll talk about Kegels, if they're actually helpful or harmful for you. And you'll also want to hear her black belt sex tip, which she'll share towards the end of this episode. We have just sold out of our Get Your Marriage On cruise that's sailing this October. But you can still come to our in-person retreat next April. The waiting list is open for that. You can begin registering. You'll see those details at getyourmarriageon.com/events. Also, this fall, starting September 7th, we're starting our men's and women's small group coaching programs. These groups are awesome because they give you a container, a safe place to implement all the principles we talk about on this podcast, plus much, much more in great depth for you and your relationship. You'll find those details at getyourmarriageon.com/events. All right, without further ado, let's go meet Kristen and talk about better orgasms through pelvic floor health. Kristen, I'm so happy that you're here today. We've been chatting and you've got this bubbly, fiery personality. And I can just tell you're so passionate about this topic, what we get to talk about today.
Yes, thank you so much for having me here.
Tell our listeners, what got you interested in what you do now? You help women with their pelvic floor, specifically with sexual intimacy. Tell us how you got into that.
First, I want to tell you, Dan, thank you so much for having me here. And I told you earlier, I feel like I know you because we get to see you on socials and you do such a good job. So thank you for the work that you're doing because it helps, pelvic health as well with people feeling comfortable talking about those topics. I have to tell you that in my clinic, I have the majority of the women that come in tell me something along these lines of, I would have been here sooner, but I was afraid to tell my doctor. I would have been here sooner, but I didn't want to talk about it to so-and-so. And the things that you're talking about are really opening doors for women to feel very comfortable or more comfortable, either talking to their friends, their spouses, or their medical providers about things that really need to be talked about. So there's that, number one. Number two, I have been a pelvic health physical therapist for about 15 years. I started right after I had kids. Initially, I didn't want to go anywhere near the nether regions. I was like, heck no, I did not become a PT to go anywhere down there. And then you have children and you kind of understand why women maybe need to seek care for things, whether it's for leakage or pain or whatever. So I started treating. I love it. But my most favorite thing to treat is pelvic pain. And I was kind of thinking to myself, like, it's kind of weird you like people to have pain. It's not that I like them to have pain. It's that I like them to not have pain and come back in the clinic and say, man, I had sex for the first time in 6 months without pain. That's like a high five moment for me.
Yeah.
If one person comes in and tells me that the intimacy was restored in their marriage, I am all about it. And so I really just wanted to continue to do that as a clinician and then also take it to, a more global level through launching Lava, which we'll talk about that later. And I'm so grateful that I get to do both because I still get to be involved in the patients' lives and I still get to do it kind of on a more grand scale like this podcast that we're having today. So
That's cool. Did you personally struggle after children or anything with your pelvic floor or with sexual intimacy in your own marriage?
I peed my pants. I'm gonna say it how it is. I
No.
was giving our oldest boy a bath, and my husband was in the kitchen, probably 5 feet away, and I didn't wanna leave the bathtub because, you have a baby in there,
Uh,
and I hollered at him and said, "I need to go to the bathroom," and literally by the time he had gotten in there, I was 26 years old, and I was like, "What is happening?" It didn't really impact my intimacy necessarily, but, that's just not confident. You don't feel confident when all of a sudden urgency hits and you just can't hold it. And so that's kinda what started my journey, and, most women after they've had a baby have a little bit of discomfort, but I never really struggled with true pelvic pain as, a lot of my patients have.
mhm. Gotcha. So, what are the common patterns with women that have pain during intercourse?
So, we have different reasons for
Mhm.
there to be pain, and I'll kinda review them just a little bit. So, we're talking about the pelvic floor, and I'm gonna do an overview of what that even is,
Alright.
because sometimes people are like, "What is the pelvic floor?"
Uh,
It's a little bit of a buzzword now. I feel like a lot of people are really educating on what it is, but it's kinda like the sling or basket that, it surrounds your vagina and your rectum, and it really is a stabilizer. It is a force generator for basically every movement that we do.
mhm.
But that area has so much more down there. We have where we go to the bathroom, we have our reproductive organs, we have our pleasure organs, plus this musculoskeletal system. And so, women who have pain, it can be for one reason, the muscles are spasm. So, if we have somebody who has pain and we have these muscles that are just holding on for dear life. Now, I want to differentiate between a spasm and strength. Oftentimes, we think if a muscle's real tight, that must mean that it's strong, and it's actually the opposite. If we have a muscle that's real tight, it is hanging on for dear life. That means that it's weak. It's just trying to do everything that it can to hold on.
Mm,
So we've got to, as far as treatment of that is concerned, we've got to lengthen the muscle first and then strengthen it after that. So it's very important that we differentiate between the two, but if we're kind of just being generic on how we're talking about pelvic pain, we can have a woman who has pelvic floor spasm,
mhm.
which would be tightness, and that's painful. Or we can have a woman who maybe has just had a baby and they had birth trauma. And so there's some stuff that's still kind of healing in there. Maybe there's some scar tissue, or they may even have a little bit of a pelvic organ prolapse, which means that some of their pelvic organs are kind of hanging a little bit lower.
Uh-huh.
Now, that can be because of hormones, but it can also be because of pushing, because they do a job that's on their feet all day. Maybe they lift heavy things, so their pelvic organs kinda hang down a
Like
little bit,
sag a
and our
little.
pelvic organ, yes, they really don't like to be touched by things that are penetrating, and so, I normally tell people pelvic pain is common, it's not normal,
Mhm.
and the way we can differentiate between, like, pain and discomfort is if you're having pain, can you change something to make the pain go away? So, if you're in a certain position and you're having pain, can you, get on all fours? Can you lay on your back or side lying and it change?
Uh-huh.
If we can change it, that doesn't mean it's normal, but I'm not as concerned about it. If it doesn't go away, if you can't change it, that's the time that you really need to seek care.
Gotcha, gotcha. I
Mhm.
read online once, and I want to know if your clinical experience backs this up. Of those that say, they're talking about like virgins on their honeymoon night having sex, and it's
Mhm.
surprisingly painful, and they have painful intercourse, especially in the early part of the relationship. A far majority of them, I don't remember the numbers, like a third, two thirds,
Mhm.
come from religious backgrounds. And I'm actually all in favor of religion. I love my faith. So this isn't to knock religion or religious people at all, but I want to understand what is a link then? Why would a study find that strong correlation?
Uh-huh. So let's take this in two different directions. One of them is gonna be anatomical fact,
Mhm.
and one of them is gonna be my assessment of what you're saying.
Okay.
So anatomical fact is obviously when you're a virgin, there's been no penetration, and so that tissue is just not accustomed. So it's going to be uncomfortable. If the hymen is still present and obviously it's being broken or perforated in some form, that's gonna be uncomfortable. And then that potentially can kinda get in a woman's mind, and those next times she starts perceiving a little bit of intercourse as pain.
Mm.
Once our body kinda gets in that cycle of perceiving something as pain, we naturally go into that pain response whenever that same thing is coming at us.
Okay.
So that's kind of my anatomical take on that. My assessment of religious backgrounds is that, and this is me too,
Mhm.
we are no, 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 and then we're go, 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 go,
Yes.
and it is like a light switch.
Uh-huh.
And from my own personal experience, that is very difficult to then all of a sudden just switch your brain to, "We can't do anything, we cannot be sexual," and all of a sudden we're supposed to, be sexual all the time. Especially because men have such a higher sex drive, and it depends on the time of life. I'm not saying all the time, we hit different peaks and we kind of all do that at different times. But it is like, okay, everything's on the table now.
Mhm.
Nothing is off the table. And all of a sudden it's just such a different flip. I've talked to patients who really struggle. Their spouse wants them to walk around naked. And they're like, I mean, for the majority of my life, like walking around naked was not allowed. And then all of a sudden now. So that I would take that part as more of a nervous system response, not necessarily like a tissue response.
Mhm.
That's the body saying, "Ooh, I'm not quite comfortable. I haven't been able to do this. It kinda hurt when I first did it the first time." And we tense up, and then it kinda creates that sequela of, so it's a I always talk about pelvic floor being layers of an onion.
Uh, uh-huh.
There's so many parts, but those would be the main parts that I would say that contribute to the situation that you're
Yeah, yeah. So,
referring to.
there's that psychological component, like what you're saying.
Mhm.
I guess as you were talking, I was thinking like, Kristen, if you're to like make a fist and I know you're about to punch me in the shoulder right now,
Yes.
I'd tense up and like,
You would tense
right?
up.
I'd tighten up
Little bit.
just to absorb that
Yep.
impact. And if that's what your
Yep.
pelvic floor is doing, anticipating this or during sexual intercourse, well, of
Mhm.
course it's going to be tight. So,
And they don't have
condition. Like,
strategies. That's kind of something, I have women who come in, like, if you have a strategy
uh-huh.
to know, like, I am perceiving this as painful. But there's actually not any, and I don't wanna make light of this
Yeah.
because I'm not saying it's all in your brain, that's not what I mean.
Yes.
But I'm saying if you don't have a strategy to say, "What is happening to me is supposed to happen, it's normal, I want it, and it's not actually painful," and be able to kinda work through that on your own, then it's very difficult to overcome that. And that's when we start seeing, people say, I've never enjoyed sex, it's never been fun, I've never," and it kinda sets them up for failure.
Hmm.
I have a lot of gals that come in, right after they're married, and I'm so grateful because it's not just pelvic floor PT is not just for, women who have just had babies or women who are leaking. There's so much more that can go into that, and just when someone has the mind knowledge of how to kind of work through that with strategies,
Hmm.
it really is beneficial.
That's great. All right. Tell me
Mhm.
about the link between a healthy pelvic floor and pleasurable orgasms.
Yes, I love it. This is one of my favorite things to talk about. I think my friends think I'm crazy, because I am so pro orgasm. Number one, personally, I mean, I love them.
Uh-huh.
Number two, clinically, it's very important. So let's talk clinically first.
Mhm.
It is a sign of a healthy pelvic floor. If you can orgasm, if you have strong orgasms, that means those muscles are working. That means the nerves are working the way they're supposed to. And we
Uh-huh.
kind of talked about, how so much pleasure comes from that area. So we'll just talk about the steps of an orgasm. Whenever you start to become aroused, probably the blood flow. Now, what gets that blood flow there is those healthy muscles that are pumping. And so if we have really strong muscles and they're pumping really nicely, we're going to have nice arousal, nice engorgement. The blood flow is going to be there.
So this isn't, you're not just talking about your heart muscle. You're talking about your actual pelvic floor muscles
Yes.
help pump the blood too. Is that what you're saying?
Yes,
Okay.
yes, yeah. So obviously your heart is pumping it to
Yeah,
that
yeah.
area, but if you can imagine that bowl
Uh-huh.
here and all of those muscles contracting, it's helping pump the blood to the area. So then we have increased arousal.
Hmm.
Also through those muscles though are all the arousal, or they're nerves, not just arousal nerves, but all the nerves. And so if we have a muscle that's working really well and muscle tone that's really good, that nerve transmission and the sensation is going to be improved.
Hmm.
Now we start thinking about those pleasure organs. So we've got the clitoris in there. All the muscles wrap around those pleasure organs and we start feeling that contraction. Our body perceives that as pleasure. And then also voluntarily, if we have a strong pelvic floor, whenever we're engaging in intimacy and intercourse, we can, do a voluntary pelvic floor contraction. And that is a way that oftentimes I'll encourage people to try to hit a climax is you can do that voluntarily as well.
Gotcha.
So
So during
the
sex, do a Kegel exercise, whatever. Right.
Yes, yes, absolutely. And, I use that sometimes if a woman's having a little bit of a hard time trying to figure out if she's doing it correctly.
Mhm.
There's a lot of strategies, and I do pelvic exams so I can help and all that. But I'm like, hey, next time you're having sex, contract around your husband and he'll be able to tell you. It's just kind of a fun way to get, the spouses involved in what we're doing and, what husband doesn't want to participate in that therapy,
That sounds
right?
like great therapy to me.
So,
Yeah.
yes, be like, "Sign me up, sign me up." So,
Mm.
yeah, and that's an important thing is
Uh-huh.
getting the spouses involved, I think, just kinda takes pressure off of the woman when you don't feel like you're doing it by yourself. Number 1, having a therapist, hopefully, that listens and is compassionate, and I obviously hope that I am,
Mhm.
but feeling like your spouse is involved, you can do things together and that there's an understanding, and it's not so much pressure.
Good.
Mhm.
Great, great. Okay,
Yeah.
so,
Yeah.
blood flow is important. So what
Yes.
happens when the muscles are too tight
Mhm.
or too weak
So
then?
yeah, yeah. So we kinda did a little bit on a spasm, it equals
Yes.
weakness
Uh-huh.
more, and then we've got, we gotta strengthen. So if your muscles are in spasm, imagine like a rubber band.
Mhm.
I should have a rubber band,
Uh-huh.
that's what I should do. And it's like real tight like this. If we start thinking about it doing any type of contraction, it's teeny tiny. So we're getting like, we're just really not getting a whole lot of movement
Uh-huh.
there. That blood flow, if you're always tight, I can only take test to a female because 'cause I'm a female, but, like, when an orgasm is coming, it is like these big pulsating until you reach that climax.
Uh-huh.
So if those muscles are held real tight, we're not getting all of that contraction, and so
Mhm.
you may not even be able to reach a climax. I mean, or it's going to be very
Mhm.
diminished or, like, a struggle, hard. It's gonna feel like work, like, you have to really think through it, and it may hit a certain point, and you just may not even be able to go over the cliff.
Mhm.
So if we start talking about weakness, we've got weak muscles and they're just kinda there.
Mhm.
Same thing. You can achieve an orgasm, but
Mhm.
it's going to take a little bit more work. They're not gonna be contracting, they're not gonna be contracting around the pleasure organs as much, they're not gonna be pulsing as much blood, the sensation's not gonna be there. And so we really need to have lengthened and strengthened pelvic floor. And when we're talking about treatment, that's how I tell my patients. I say, if they're in spasm, we're not doing any strengthening yet. We're only doing lengthening, and I think kind of a problem that we're seeing nowadays with social media and some other things is everybody's all about pelvic floor strengthening. There's chairs that you sit on that will, do contractions.
Uh-huh.
There's different people who are saying, "Now squeeze and relax and squeeze and relax," and it's awesome because it's making people very aware of the pelvic
Uh-huh.
floor. But in theory, that could be a detriment to someone who had a tight pelvic floor. We need to
Gotcha.
make sure that we're able to lengthen, and lengthening includes, like, being able to void, not having to push to pee,
Uh-huh.
not being constipated. If you have a tight pelvic floor, those may be some symptoms as well as pain with intercourse.
Mhm. So how do you lengthen them? Is it just putting your thumb in there and just massaging and stretching?
You can, yes, yes. So there's a couple ways. So in my clinic, I'll do manual work, which is exactly what you're
Mhm.
talking about. So we'll do a pelvic exam, and the difference between like a gynecological exam and like what we do as a pelvic health PT is we're focusing on the muscles and the coordination.
Mhm.
Where you go to the gynecologist, you go to your OBGYN, they're checking on organs and those sorts of things. So when I say pelvic exam with my patients, I kind of like to differentiate. Like, I'm not putting you up in the stirrups and getting the stuff out. I don't need to do that. I just need to be able to do a one finger palpation. And if it creates the symptoms you're having, we're on to something. Or, if somebody's able to contract around my finger, I can grade how strong they are, that sort of thing. Then we can treat it through either like a tender point release, that sort of thing. But really, a lot of the times, we work on breathing. So all of us are terrible breathers, all of
Uh-huh.
us. Like,
Yeah.
I don't know that I've met one really great breather. And so the pelvic floor is supposed to drop and relax when we take a deep breath in. So if you imagine like your diaphragm opening,
Mhm.
this should be a big oval where your pelvic floor drops. So working on that coordination and even just being able to take that big breath helps people do more voluntary relaxation. And then we call it down training. It's kind of a fancy word for stretching. There's very specific stretches that also, you know, kind of target the muscles of the pelvic floor. And then a lot of it is that the neural regulation is allowing your body to feel safe reminding it that it's safe, making sure you're participating in what you're participating in an environment that is safe. And that kind of goes a little bit out of my clinical expertise, out of my scope of practice when we start talking about
The
that.
mind
But
matter?
I have
Mm,
great
mhm.
Yes, I have, I can get a little bit there, and
Uh-huh.
then we have great I have a great referral source to send people to if we need to, but that's a really big component, and, things that occur to the pelvic floor, if we're talking about in a traumatic way, just really impact people for a long time, and so that's very common for me to refer on to someone who has more expertise than I do in that area.
Gotcha. When you say that doing certain, physical stretches, I just imagine it's like doing a deep lunge or, like, what?
Yeah, so you can do
Uh-huh.
happy baby.
Uh-huh.
Yoga
Yep.
poses or child's pose or, the lower abdominals are really involved in the pelvic floor, and
Mhm.
so, especially as a woman, oftentimes I think we try to hold those in just, to have a nice physique, and if we are constantly holding in our lower abdominals, those have an impact there too, so upward dog, which is kind of the yoga,
Mhm.
the seal.
Yep.
You can stand and do where you, like, pop your hip out and kinda get the inside of your leg, that's called your adductor, where it goes from where your pubic rami, which would be kinda, like, up by your vagina all the way down to your knee on the inside.
Mhm.
A lot of people have probably heard of your piriformis, it's like when people have sciatica,
Okay.
it's that muscle. Now,
In the
there's other
lower
reasons for
back.
sciatica.
Uh-huh.
Yeah, there's other reasons for sciatica, the piriformis isn't the only one, but if we're talking about, like, a muscular component of that, it'd be the piriformis, and so pigeon stretch, where you put your foot in front of you and kinda like, that's another one we do, and then, sometimes we use a tennis ball to kinda do some external release for patients to do at home, and we also recommend oftentimes getting a TheraWand, so that's just a wand that they can use and place on those painful areas. If they come see me once a week, twice a week, like, I'm not getting to do any manual release every day, and so some patients who are really motivated, are kinda tired of what they've been feeling, and they really wanna get after it, they'll get a TheraWand and do that treatment at home on their they can do it on their own.
Gotcha. Alright, good.
Mhm.
So, if you have hypertension or if you're too tight, saying, "Do more Kegels" is the wrong advice.
Yes, absolutely the wrong advice.
So, instead, we want to learn how to relax the pelvic floor. Is that right?
Uh,
So,
mhm.
how do
Yeah,
you talked about breathing and coordinating breathing better and connecting that. Is that connected
yeah.
to relaxing the pelvic floor?
Absolutely, and this would be something maybe your listeners could do, like, we could do it right now. If you lay down in your bed
Mhm.
and you think about trying to do I'm gonna say a bra breath because I know what it's like to wear a bra.
Right.
You do a breath into your bra, so that means you're taking your ribs out into your bra strap. And see if you can do a relaxation of the pelvic floor, which would be like a flower blooming. So the labia of the vagina would kind of open into your underpants. If you can do that big breath and allow the labia to relax at the same time, filling your whole trunk with air, then that's a voluntary pelvic floor relaxation. Now, sometimes when I have people who really struggle with tightness or pain with sex,
Mhm.
I'll say, hey, you and your spouse lay down together.
Uh-huh.
Why not? It can be kind of a ritual that you do before. It's very relaxing. It's very calming. It kind of gets you in the right headspace. Saying, hey, I need to stretch is not quite as fun. I do tell them to do that. I'm like, for now, you don't have to do that for forever, but setting yourself up to have success during sex and not have pain is also part of breaking that cycle of your nervous system feeling like you're gonna be in pain every time.
Oh, yeah.
So,
Like,
even if you have to take a minute and do that stretching,
that makes sense. Like,
I tell 'em to.
I love to
Yeah.
run, and if I'm gonna enjoy my
Mhm.
run, I'm gonna stretch
Yeah.
first.
Yes,
Or,
exactly.
before tennis, I'm gonna warm up.
Mm,
Like,
uh,
so sex, it's okay to warm up.
yeah, yeah. If somebody needs to, that's a really good strategy, and then also just the breathing is just kinda nice. It can be very sensual, depending on how you approach it.
Alright, so let's say you're more on the weak side, not the too tight
Mm,
side. You just haven't strengthened it. How do you
yeah.
strengthen?
Yeah, we don't need to lengthen, we need to strengthen in that case. So let's talk about maybe some symptoms for someone
Okay.
who has a weak pelvic floor. So we're maybe going to have some leakage. Now, leakage looks like it can be urgency, like all of a sudden it just hits you and you have to run to the bathroom.
Uh-huh.
It can be stress incontinence where you cough or sneeze, and I'm sure you've talked to lots of mamas out there and they're like, "I can't jump on a trampoline anymore." And that's why,
Mhm.
because the pelvic floor just with that quick contraction isn't able to hold. It can look like pain, and that's more, we're gonna see some prolapse stuff there because women have pushed and pushed and pushed, and if we push enough, over time, those organs go to the area of least restriction, and for a woman, that's the vaginal opening, so they're gonna kinda just go to that area,
Mhm.
and so those are mainly the symptoms. A lot of times, and this is obviously not about intimacy, but I just have to throw it out there, women who have had lots of babies may have an abdominal separation.
Yeah.
And so that's called a diastasis rectus abdominis,
Uh-huh.
or a DRA. And that is very impactful on the way that we generate force with the things that we can do with our body. And so that might be a sign of a pelvic floor weakness as well. So then we need to strengthen. Now, a Kegel, however you want to say it, is the generic strengthening thing. However, if you talk to a forum of pelvic floor PTs and you told them that you were only doing just that generic contraction,
Uh-huh.
they would probably all lose their minds
Uh-huh.
because we want to make it functional. And so we may teach that initially, and then we want it to be, more of a multi-muscle type contraction. So squats and lunges and clamshells. And then we want it to get to where your body is just naturally contracting your pelvic floor whenever you're doing your activities of daily living. And that just comes with a lot of practice and a lot of awareness.
That makes sense too, because like if I want to
Mhm.
strengthen my bicep, if I just sit here without any resistance and just, so I'm
Mhm.
just flexing my arm and relaxing it over and over again, it's not going to
Yeah,
do that much. But now I add a
right.
dumbbell and do the same
Mhm.
movement with more resistance. Now it's going to get
Yeah.
stronger faster. So I
Mhm.
think that's what you're talking about.
Mhm.
Like if you just do the Kegel alone,
Mhm.
add something else to it because muscles are
Mhm.
stronger with some resistance. Is that what you're saying?
Yes, a little bit, and there's just a very rare time in our life that we need to do just a pelvic floor contraction, you know what I mean? Like, whenever we're having those symptoms of whatever kind, it's not typically because we're just standing still doing nothing.
Oh, like what's an
If we're
example?
gonna
Like
have
picking up something off the
Mhm.
ground or like doing
Yes,
twisting
so
or
yeah, leakage. If a woman's having leakage, it's not normally when they're just like laying flat on their bed or like standing up. It's when they're doing something, when they're lifting a kid, when they're doing that stuff. So we really want to make it to where your pelvic floor is able to withstand more functional movement and not just like, okay, you're strong in this one position. We know those muscles can contract, but
mhm,
can they contract when they're put under a little more pressure, not necessarily just resistance, but just like life,
mhm. Yeah.
you know?
Yeah, yeah.
So, mhm,
What about
yep.
those, they're marketed like Kegel is one brand
Mhm.
that you insert into the vagina. It has some sort of a sensor, and you squeeze around it, and oftentimes
Yeah.
they pair with a
A
app or
strong
Bluetooth, and there's games you play while you strengthen.
yes,
Yeah.
yes. So, like the Perry Fit, there's
Uh-huh.
quite a few of those,
Uh-huh.
and they're good. I think they're very good, especially for people who need that type of feedback. So that would technically be like a biofeedback,
Uh-huh.
Sometimes people need to see that they're reaching a certain goal, so
Mhm.
it kinda depends on your personality, I think. Strengthening alone is not bad. That's what we have to do. We have to break the muscle down and rebuild it back up to be stronger.
Uh-huh.
It's just the mindset that you need that extra step to make it functional as well. So those are good practices. It's not bad to be using those, but then we also want to make sure that you're able to use it in a more functional setting.
Gotcha. Great, great.
Mhm. Yep. So
Anything else on strengthening?
I think one of the things just from my own personal standpoint is I'm a very active worker outer.
Uh-huh.
And so I feel like as females, and I have children and I have a job and I have a business and we take on a whole lot. And oftentimes we find ourselves holding a whole lot of tension. It may not even feel like we feel stressed, but like, I want to have a nice physique. I want to stand up tall. I want to look fit. I want to have it all together. And we find this like consistent clenching, or like when we're driving, sometimes I'm driving and I'm not really stressed, but I'm clenching my butt cheeks and I'm like, what am I doing?
Yeah.
And so there is potential for us to become, probably not intentionally, but our body to become so used to holding everything in and and kind of clenching that we swing ourselves from one pendulum to the other pendulum. And
Mm.
so I always like to really reiterate that we need a lengthened and a strengthened pelvic floor in order for it to do all the functions that we need. And there is potential for someone to become so hyper aware of their abdominals and what their pelvic floor is doing that we kind of swing to the other side.
Mhm. Got it. Great.
And then start having, those symptoms of pain with intercourse or urgency that's not really a UTI. It just feels like a UTI
Mhm.
because the muscles are contracting around there. So we kind of start, a person would know that there was something going on down there, but it becomes confusing because you're not sure if it's actually, is it really bacterial? Is it really more muscle tightness or spasm?
That's good to know. That's good to know.
Mhm.
All right. Tell me why you like in certain circumstances, you prescribe vibrators.
Oh, yes. This is one of my favorite things to talk about.
Mine too.
Okay, so yes, yes. So let's just get going. We're going to talk about a certain generation. And it's not just the generation, but I see patients who are in older generation and a lot of them have never had an orgasm. Now, it's not that just that generation. I'm not trying to group it in there. Oftentimes there's other people too. But just in my experience, I'm talking to them quite often, and I want to know if you can have an orgasm. I want to know if they're hard to have, if they're pleasurable. Are you reaching a full climax? Like, what your take on that is. And if I have somebody who either is struggling with having one
Mhm.
or has never had one, and then we start talking out of the clinic just for fun, but, we're talking medical part right now. I really want them to be able to have one, so I will prescribe them to get one. Obviously, that's not done in the clinic, that's out of my the ability the knowledge of the ability to have one and the muscular part is in my scope of practice, but the way they use it and where they use it, they need to do that on their own.
Oh, you don't
And
have, like, a
so
little you
no,
peel back the
no
curtain and
rims,
there's a
no
nice
peel give
grass
you a little
display.
time. No, no, no. So, I normally say to get that on your own time, but I had this lady call me one day and she was like, "Kristen, I got my gadget. What do I do now?"
Uh-huh.
Which I just love because it makes me feel like they feel comfortable with me. But
Yes, they
I have a
trust
friend.
you. So you walk them
Yes,
through over
they
the phone
trust
how
me.
to use it.
Yes, yes,
Uh-huh.
and so I had this lady one time, and she was in person, and, we really talked about anatomy because you have to know where to place it. Like, it can go anywhere you want it to go, but it really needs to be over the clitoris if we're gonna really be trying to facilitate an orgasm. So, I have my computer pulled up, and we have the clitoris up there, so I'm showing her where, and she was like, "Well, when do I do it?" And I was like, "Well, whenever you want."
Uh-huh.
And she was like, "Well, where do I do it?" And I was like, "Wherever you want."
Uh-huh.
And she stopped for a minute and she thought and she goes, "But what if I like it?"
Uh-huh.
And I was like, "Oh, honey, you will. That's one thing I can guarantee, you will."
Uh-huh.
And so most of the time they have success and, obviously that's something that for their own personal pleasure, I'm so grateful that they're able to do that, but also from a pelvic floor standpoint, it just gives me a whole lot of information about what their pelvic floor is doing. So I'm a huge advocate of vibrators. I talk about them all the time because I want to know if a patient can have a orgasm. That's one of my main questions. It's just because it gives me so much information about what the pelvic floor muscles are doing.
Got it. Do you
Um,
recommend certain models or certain kinds? What's your advice generally to
and
women about toys or
I
vibrators, I should say?
I mean, from a personal standpoint, I love toys, but if we're just talking vibrators, personally, from a pelvic health standpoint, I normally recommend the simpler the better.
Uh-huh.
If someone has never used a toy before, from a medical standpoint, I'm really wanting to help promote it to be comfortable and something that's beneficial for them in lots of ways. And I feel like the simpler the better makes it feel like it's less because sometimes I do need to tell them, like, I want you to do this for a medical standpoint. I have a lot of people who really struggle with, for whatever reason, the use of a vibrator
Uh-huh.
when they're not thinking about it in a medical way.
Yep.
And so I'm very happy to say this is a medical way. Like, we need to see if you are able to have one. And that kind of changes their mindset. But I feel like we start getting as much as, from my own standpoint, I think all the toys are kind of fun. When we start getting too wild with the buttons and the appendages and whatnot,
Uh-huh.
that also causes a little bit of stress from a medical standpoint.
Yeah.
So I typically just recommend a very generic get the job done one.
If someone struggles to orgasm even with a vibrator, what's your next step?
Yeah.
That's good information for you.
Yes, it's very good information for me. So if someone's coming to me with pelvic pain or difficulty orgasming, I don't do a pelvic exam on every single person. Sometimes they're not comfortable with it. We obviously want to have consent and I want them to feel comfortable, but I need to do a pelvic exam. It gives me a whole lot more information. When we start thinking about symptoms, if they're struggling to have an orgasm and they have pain with intercourse,
Mhm.
I'm starting to think, we're probably spasmed. If they're struggling with an orgasm and they've, had multiple children and they have never sought care from a physical therapist before, and maybe they do have a little bit of leakage, then we start thinking that maybe the struggle is because they're having weakness and those muscles just aren't able to do what they need to do to reach like the climax that potentially they could reach otherwise.
Mhm.
And so we really got to start thinking clinically there on what the other symptoms are as well. But when I do a pelvic exam, I can tell. I can either tell if they're tender to palpation when they say, "Ooh, that doesn't feel well," or if when they contract around my finger, if I can feel if the muscles are actually doing what they need to be doing, it gives me a whole lot of information. And so we just put all those pieces together and then create a plan after that.
That's so good.
Yeah.
So you launched a new lube company called Lava Lube.
Yay.
My wife and I have been using
Yes.
it. Thank you.
Yay, great. You're
Tell
welcome.
tell me about how that came about.
Yes, absolutely. So I mentioned at the beginning how much I love treating pelvic pain, and I just really liked that I was able to have a small part in restoring intimacy with couples. And it just felt so satisfying to me, and so I really wanted to take that outside of the clinic. I'm still in the clinic 2 days a week. I love seeing patients. I think I'll do that probably for as long as I can just because it's something that I really love to do. But I wanted to take it on a broader, grander scale.
Uh-huh.
And things like this as just there's lots of physical therapists that are on social media, but me, my personality, I would not have probably pursued podcasts or pursued social media as far as communicating the importance of sexual wellness and all of
Mhm.
that stuff had I not had some sort of springboard such as lava to do that. So we launched last July with a silicone-based personal lubricant. We chose silicone because it's, in my opinion, the most diverse overall.
Mhm.
Now, I do have to say you can't use it with silicone toys, so there's the negative, but from a pelvic health standpoint, when we're talking about pH and we're talking about hypoallergenic and no dyes and no fragrance and no preservatives, there's so much about silicone lube that is really great for people who are having pelvic pain or maybe are a little bit sensitive dermatologically, like maybe have some skin stuff going down there. And so it really was kind of the most generic way to launch. We are now doing formulations for other we have a clitoral stimulant coming out this spring. I'm so excited about that one. And then some other really cool, more sexual wellness ritual that will I feel like they kinda get you in the mood, you know?
Uh-huh.
They're not necessarily just related to sexual performance, but it's just about the time it takes to get aroused and this, feeling of being sensual and just togetherness and not just solely about the penetrative part.
Gotcha. You beta
So
test
perfect.
your own products, and I'm sure
Heck yeah, I
you gotta
do.
no, test that
Yeah.
again tonight. Another batch.
Yes, so
Use up.
my husband, the clitoral
Poor
stimulant, I want it
husband.
to be
Oh, man.
perfect. Oh, he loves it. So the clitoral stimulant, we've gone through maybe 6 or 7 sample trials so
Mhm.
far because I want it to be perfect. Like I just it's kind of a lab even more than the lube.
Uh-huh.
I think it's just, like, something that's very much on my heart because I know a lot of women struggle with orgasm. Now, it's not just for women that struggle with orgasm, it just feels good, but I think that's probably why that's so much on my heart, and so I really want it to be perfect. Anyway, they send the samples here, and so anytime I come in, I'm like, "Babe, it's sample day."
Uh-huh.
He hasn't complained one time, so I think he is fine that we're not on the final formulation just yet because, once the testing is done, he's just gonna be like, "Well, where are our samples?" But he's been my biggest cheerleader by far. He tells everyone about lava. He, wants to give everybody samples. I'm just very, very I have a great team
Mhm.
that's rooting us on, and it's been really, really fun to be a part of the sexual wellness world in, kind of a medical capacity, but also being able to share experiences that, like, my husband and I have had. We have a really great marriage, and I feel like I kinda have a chip on my shoulder about it a little bit because I'm just so grateful, and so I want everybody to feel that,
Yeah.
whether it's because they're having pelvic floor struggles and we can kinda work through that, whether it's, they're a little bit nervous to try something different in the bedroom and they just are kind of craving some novelty, just drizzling lube all over you, it doesn't, it's just fun.
Uh-huh.
It's something different. And I always tell people our bodies crave novelty. That's why we like to go to new restaurants.
Yep.
It's not that we need to change what we're doing. We don't need to change who we're married to. We don't need to change all of that stuff. We need to just introduce something different. And if we can use a lubricant, for penetration, if we can use it for a back rub, if we can, do little things here and there that just kind of keep creating that spice in the bedroom, that's, what lava's here for. So hopefully we're helping people do that.
Great. Kristen, this has been
Mhm.
such a great episode.
Yay.
So let's
Thank
say you're
you.
listening to this, you lengthen, you strengthen,
Yes.
sex is more pleasurable, less painful. We got the lava lube now. Things are slippery
Yep.
and wonderful. What would you say is your black belt sex tip? I'm putting you on the spot here. What would you
You
advise
didn't
me
tell
here
me about this
that
one.
will take sex to wherever you are to something a little extra, something a little nice? What advice do you
Yes,
have
okay.
to spice things?
So, I'm gonna go back to that growing up in, religious households,
Mhm.
okay? So, I did. And I don't think obviously, at that time, you can't comprehend what you don't know,
Yep.
and I'm grateful that I didn't know it. I think one of the most important things that Dustin and I have done is allow ourselves to explore. Now, it's just he and I. I'm not saying that. I'm not telling you to bring things in from the outside. I'm not saying any of that. But if there's something that one of us wants to try, whether it's, something as silly as using chocolate syrup
Uh-huh.
or something, then we're all about it. But we communicate it very well. And I think we all go back to communication. I urge everyone to try it, try saying, "Hey, I really feel like maybe this might be fun." And I think I'm kinda taken aback sometimes when I'm talking to my patients about just their life in general, the lack of communication
Yeah.
on sexual things. It just kind of is what it is, and then they're just that's just where it is,
Right.
that's where they are. And so I think my number one thing is allow it to be fun. Really communicate, and if there's something that you want to try that's a little bit different, maybe it's a different room, maybe it is a toy, maybe it's a toy with all the weird things sticking off, I don't know. Try it because you leave that moment, and I said the chip on your shoulder. I feel like I leave with a chip on my shoulder. It's almost like we have this little secret, and it carries me throughout the day with a smirk on my face,
Uh-huh.
where you wake up the next day and you're like, man, that was
You
awesome.
share a
It's something to
secret.
talk about
Yeah.
again. You can send little text messages like, hey, I really enjoyed that. I'd love to try this next time. It just creates such a special feeling surrounding intimacy,
Uh-huh.
and it makes me want to do it again.
Uh-huh.
Where I think that's the goal, right?
Yep. So, make room
Okay.
for exploring. That's
Make room for exploring, throw a little lava in there, wait till the clitoral stimulant comes out, everybody get it, it's gonna be great. And I don't know if you'll put this in the show notes, but we did a get your marriage on code for GYMO 20. So that'll give you 20% off your
great.
first
And what's the
order.
website address?
mylavalube.com.
Great.
And then that's the same on the socials. So, I'm not an influencer. So if you see me on social media, it might be good, it might be bad, but cheer for me if you would.
Great.
Give
Great.
me a
You
little high five. We
are
know each other now.
awesome.
Yeah.
Oh,
So
Kristen, thank you. Thank you.
yeah, you're very welcome. And if you get any questions further than the ones that we've done already, I'm always here. Please just shoot me an email and we can kind of approach those. I like to tell people on podcasts like send you an email and then we can kind of follow up. But my big takeaway on pelvic floor is please don't be afraid to talk to your physician about it, and also please don't be afraid to share it with your spouse. Like painful intercourse and difficulty with orgasm can be fixed most of the time. It's not a cover your face and bear it. It's not that sort of thing. And with the right care and the right people, your sex life can be so much better. So there's really not a reason to wait. Talk to your doctor, see a pelvic health PT. If there's something they can't do, most of them will tell you, but I've never really had that experience. There's always something that we can do to really make sex feel so much more pleasurable.
That is good. Thank you. Thank you.
Yes. You're welcome.
So, what did you think of this episode? Pretty good stuff, huh? If you want to go get her lava lube, I recommend it. My wife and I use it. You can find those details in the show notes. Also, if you want a little extra help implementing the principles we talk about on this podcast, including helping you have better orgasms or intimate conversations in your relationship, you want to check out our Get Your Marriage On program. You'll see those details on our website. Also, please share this podcast with your friends and go get your own marriage on. Talk to you next week.